And right now, if we had this insertion direction, our entire contact area is inside of the undercut of the neighboring tooth. So since it will mill the internal of the inlay with this path of insertion in mind, we're going to have some trouble trying to seat this because of the contacts being in the undercut. So how do we fix that? So what I recommend doing So the topic for today is partial coverage restorations. It certainly is one of my favorite things to do with the system. So I appreciate you joining in. This is, I think, a special topic for me. I've always tried to preserve healthy tooth structure when possible. Of course, crowns, everyone's familiar with crowns, knows how to do crowns, I'm sure, really well. But partial coverage, it's a little bit trickier. And in dentistry, when we are trying to be more conservative, it oftentimes is more challenging. So we'll dive into the how-to, what is a partial coverage, how to best prepare teeth for a successful milling with your fast mill. So let's just dive right into it. And as Helen mentioned, if you have questions as we go through this, feel free to drop it into the chat or the Q&A section, and we can answer those near the end. All right, so just quick definitions. Inlays. Inlays are restorations that are intracoronal, that do not restore any cusp tips. And onlays we'll define as restorations that cover at least one or more cusp tips. I just kind of go with overlay. And it essentially just means a full occlusal coverage restoration. And so you can see an example of that on the right. So it is closer and closest to a full coverage crown, where we're trying to preserve more of the healthy buccal and lingual areas of the tooth. To the system, for an overlay, you'll want to define it as a crown. So any type of full occlusal coverage, buccal to lingual, mesial to distal, the full occlusal, you're going to refer to it as a crown. It just will generally create a better proposal. Now, any other partial situation, if there was one cusp remaining from that overlay, if you imagine the full occlusal, but one cusp is healthy and you leave it, then you'll enter the inlay onlay indication for the software. Now, what materials can you use for these partial coverage cases? So my go-to is the camouflage now. So this can be used for any of the partial coverage indications, inlays, onlays, and the crown lays or overlays. Obsidian would be another choice. So the obsidian is a material that's a lithium silicate block. This is the only material that does, however, require an oven cycle. So you would need to fire this after milling. So if you don't have an oven, a porcelain furnace, you won't be able to use this material. The third option would be Bruxer now. And as you can see, it's not indicated for inlays and onlays, but you could use this for an overlay or the crown lay. And to enable this material for a crown lay or overlay, you're going to define to the system that you're designing a crown or a full coverage crown, and that will give you the option. If you set it up set up the case as an inlay onlay, you would only have camouflage and obsidian as your material options. I love camouflage because of how quick it mills. I'm very comfortable with using obsidian, but camouflage, it just mills so quickly, I can get the patient in and out. And as long as I can establish adequate material thickness, good preparation, good depth of preparation, and a good sound bonding protocol, which all of these types of restorations, you should have a really good adhesive protocol, because most of these preps are going to be somewhat non-retentive. So a good bonding protocol for that micromechanical retention. All right, so we're going to talk a little bit about the tooth preparation first of all. Anytime we're preparing a tooth, We're just kind of trying to balance tissue preservation, preserving as much healthy tooth structure as we can, and selectively removing where we need. So to establish the proper form and function, optimal strength, the aesthetics just kind of falls in. That's kind of the byproduct of establishing good function and form. And for the system, ease of fabrication. So we're going to discuss what the system wants to see to create a nice fitting and seamless transition restoration to your prep. Now, partial coverage cases will really fall between any of these two. There's not one type of inlay preparation, one type of onlay preparation, and that's kind of one of the fun things about it. It can really take on a variety of shapes in order to restore whatever defects or pathology there is on the tooth. So everything from a little slot preparation, which normally we're going to use for a composite, a direct composite certainly for the most conservative ease of fabrication restoration, but everything really in between that. So if it's a little bit larger restoration, larger contact that you need to restore, an indirect restoration might be the way to go. Just some examples of what falls in between. These are just some examples of my inlay and onlays. You can see they're all different types, and we prepare them based on the situation, whether there's an existing restoration, whether there's any carious tissue or cavitation. And I'll break down kind of my thought process on how I'm going to prepare these. But first, a couple cases. So this patient, this is number 4 or 5. You can see they're missing one of the premolars. You can see somewhere. But this patient had caries on the distal of this premolar. So what we're going to do is begin opening this up. And I'm sure many of you have seen this many times before. We're going to go in and remove the carious tooth structure. But essentially, we like to use the DEJ as kind of a roadmap. Like, how large are we going to make the external outline? How deep do we need to make the restoration? And so I'm following the DEJ toward the lingual. As we know, you can see this is a great illustration of the carious process through the tooth as it cavitates through the enamel. Once we reach the DEJ, the caries expands across the DEJ. So using the DEJ as a guide to determine how wide to dissect and circumscribe the caries that's left on the dentin, then we clean all of that out. This is what the final preparation looked like. I extended it a little bit more. I broke the contact toward the buccal, sharp cavo surface margin, and we can mill. In this case, we milled out a camouflage restoration, and most of the cases you're going to see will be with camouflage. Now, you might be wondering about the wear facet on the buccal. If you included that in your preparation to make it more of an onlay, I would not say anything is wrong with that if you just want to restore them together. I decided during the bonding, during the cementing, I'm just trying to take the most conservative approach. We make the inlay for the preparation, and then when I go to bond, I etch the area and do a little spot bond with some flowable on the buccal. So that's just the approach that I took. And as with many things in dentistry, there's many different ways to go about repairing and restoring the situation. So that's a camouflage now that we bonded in. Now that was just, the preparation was purely based on trying to restore the carious tooth structure on the distal and making it more millable. Now this situation, I'm sure you see this in your practice as well. Large amalgam restorations, and as we know with amalgam, the surrounding tooth structure very easily is unsupported and very easily can fracture off. We often see this on the non-functional areas. So this is an the upper quadrant, upper right. So we're going to focus on restoring number 3 and 4. So we're going to do an onlay to help fix you can see on the buccal of number 3, that fracture there. And again, on the non-functional side, when the patient is in normal occlusion, normal cusp-fossa relationship with the uppers more buccal, we often see the buccals are more susceptible to these types of fractures. And on mandibular teeth, the lingual side, is more susceptible. And we'll kind of review that in a little bit. But we're going to do a couple restorations. So large inlay, onlay on number 3, and a little inlay for number 4. And we once again mill out. Now the external outline for this, a lot of it is dictated, of course, by the defect, where we need to restore. But of course, the existing restorations, the areas that are leaking, and we want to transition that into an indirect restoration. And one of the things with amalgam restorations, as we probably know, the preparations for amalgams to help retain them often have a lot of undercuts to keep that in. So we also have to try to be careful as we transition it from a direct amalgam type of preparation with undercuts to making the preparation, in this case, a little bit more divergent to eliminate those undercuts so that we can have a passive, good path of insertion. So these are a couple of camouflage restorations. This is just at the try-in. And on the try-in, most areas do look pretty good, but an area that I want to point out to you is on the buccal of number 3. You can see, let me see, I don't know if you can see my pointer, but I kind of mismarked the margin. And this is even after doing so many of these, one of the areas that can be a little challenging to kind of decipher when you're marking the margin are on these occlusal areas. As much as we try to create a real sharp cable surface margin, which I attempted to do here, because of that incline slope of that buccal cusp slope, it just came out a little less defined on the scan, and so I marked it a little lower. So this is where that initial restoration is, and not a big deal. You know, if you come across this situation, I know we're trying to preserve tooth structure, but you know, we could have gone through and just used a burr and, you know, perform some enamelplasty and take that down. But I didn't feel too great about that. I wanted to see if I moved the margin to cover more of what I intended to cover. So if you focus now on that buccal area, that's the original, and this is after modifying the margin. So one of the things you really do have to be careful with is the position of your margin. Everything else stayed the same. I just wanted to have a little bit more coverage on the buccal. And so a couple of camouflage restorations, you can see how nicely they fit, and then we bond everything in. All right, so a good look at the camouflage restorations milled out. For most of my camouflage cases, you can see this is an A to LT. I do like to use the LT really in 99% of the cases. It really is practically 100%. Every so often I try an HT, and I'm often left somewhat disappointed in how gray they look. So unless you have a really gray situation, you know, maybe older patient, a lot of gray tooth structure or darker tooth structure, the HT might blend in better in those situations. But for the most part, I think LT has a little bit more warmth and chroma, just a really nice look to it. So this is where we started, and you can see the prep is not growing a whole lot more beyond the defect. You can see the finished restoration, not a whole lot more. And so that's one of the beautiful things about this partial coverage approach. Just we're able to preserve everywhere else that is healthy. And a look at the radiographs. Camouflage comes up nice and radiopaque. Almost as much as the amalgam, practically as much as a metal restoration. All right, something else that you have to keep in mind for all restorations in the system is how the burr adapts to your prep. We're thinking about how is the burr in the mill adapting to your preparation. And this applies to full coverage cases, partial coverage cases. The burr in your mill is a round-ended, as you can see, tapered diamond. And one of the dimensions that you really have to consider is the diameter of the tip, which is about 1.4 millimeters. So what this means is any sharp transitions, sharp areas to your preparation that are smaller than 1.4 millimeters, the mill is going to have a little bit of trouble with it. It either is going to have trouble with it or it's going to over mill. Okay, so starting off, if you can imagine, let's start with the crown prep. If you have a sharp area on a crown prep, and it's really sharp, smaller than 1.4, the mill is going to over-mill. It's going to take away more material internally. And the same would apply for an inlay. If you create these really sharp transitions, it's going to be more challenging for the system to create those sharper transitions. So you want to think about the only sharp area we really want on our preparation is at the margin, right? A butt margin, or cable surface margin, sharp transition from where you prep to the cable surface, the unprepped area of the tooth. And everywhere else internally, you want them to be rounded. So margin design, you want to have more of a chamfer, rounded shoulder margin design, and then any transitions around the tooth, over occlusal axial, you want to think about rounded corners. And going to the tapered aspect of the burr, you can see how understanding that it does taper, it's about 3 millimeters from the tip, so it's really only for very tall restorations or tall preparations where this can be a factor. Imagine a really tall anterior preparation that is feather edge margin, so meaning very little axial reduction and the vertical walls are very parallel. So that's an area where the mill may encounter some issues. So as long as you've prepared enough at the margin, so just kind of thinking about maybe a full coverage crown prep first of all, as long as you reduce enough axially, eliminate the undercuts, especially any undercuts at the margin itself, the system should really have no issues with that. Now, another visual for you is this is what the block and the burr looks like in the system, so in your mill. So you're familiar with the burr on the left-hand side of the mill, and the restoration and the block is in the back of the mill. This is illustrating the margins getting cut on the left-hand side. The burr and the block do not rotate at all. So the block itself can go in and out, up and down. The burr can go in and out of the restoration, but both of those don't change angulation. So that means the 4 axes. It goes in and out on both ways, up and down, and the burr itself goes in and out of the restoration. So you can imagine if you had any undercuts at the margin, the mill's going to have a tough time with it. Now the good thing is if you have any undercuts on the vertical walls of the prep, as long as those are inside of the margins of your prep, then you should be okay, because the system actually can't mill that out for you, and you can think about it as a natural block out for those undercuts. So because the margins of this type of onlay, from a bird's eye view, that path of insertion view, I am able to visualize all of the margins and most of the walls of the preparations. In this case, any areas that are like an inlay are divergent, or any areas on the external surface are convergent, just essentially eliminating undercuts. The system will be able to create a good restoration. All right, let's dive a little bit deeper into the preparation if any of that is confusing for you. The burrs that I like to use, these are just a few examples. So I like using round-ended tapered diamonds, so for both full coverage and for partial coverage. These numbers are from Brasseler, but really any burr manufacturer should have these types of burrs. It doesn't have to be diamonds either. You can use carbides, of course. It's more about how is the burr going to create that internal shape of your preparation. So round-ended natured burrs, round-ended geometry burrs are going to create a rounded corner and be more favorable to the mill. I like using a flame burr on the right-hand side, as you can see. That I like to use to eliminate any unsupported enamel, especially if you can imagine on inlays, the interproximal box areas. As you use maybe a regular round-ended diamond, it's real easy to create these lips that come into that interproximal. So I like using the flame burr to kind of eliminate those and just open up those interproximal zones. And I'll try to point that out on some of our preps as we go through it. All right, so I like to use the acronym CADET. This is what I learned in dental school at USC. The acronym stands for starting off. This is what I learned in our direct composite, trying to keep our preparations for direct composites as minimal as possible. So we'll start here, and then we'll expand into, once we remove the caries tooth structure or any cracks in the tooth, how we can transition that and make it more favorable for milling. All right, so the C will stand for caries or cracks, so removal of the infected tissue or defects. Pretty straightforward. Access, how will the restoration, I like to think of it, how is it going to insert into the prep, and how will you access those margins to finish if there is any need to finish and smooth the margin, certainly accessible for removal of the cement, which is great. So access to those margins, how will you be able to insert, think about insert and access those margins. Decalcification, removal of demineralized tissue. It's usually flaky or chalky when the decalcification. Sometimes there's decalcification and the tooth structure is hard. So then we'll typically leave that behind. But if it's easy to kind of poke away, you're going to want to remove that. Existing restorations, just remove them, ideally, at least within a safe zone. So we'll talk about as we get near the nerve and some areas that a certain depth into the preparation that you have to try to avoid and be careful with. Terminating, so the final thing is terminating on sound tooth structure. So that's pretty self-explanatory. Any caries tooth structure, any weakened areas of the tooth, you certainly don't want to terminate your preparation, and you would want to include that to be restored. All right, so that's the most minimal preparation using the CADET protocol. So CADET, as we just reviewed. All right, so beyond that, just a reminder, cable surface margins, you want those to be sharp. It's going to allow for a nice butt joint, really good transition. The system's going to be able to adapt. It makes the identification of those margins easier in design. Thinking about the path of insertion or path of draw. So if you can imagine whatever bird's eye view you plan to insert the restoration, this applies to full coverage crowns, partial coverage. From that path of insertion view, you want to eliminate your undercuts. So if it's a crown, you make those walls more convergent. If it's an inlay, you make the walls divergent. So that bird's eye view, trying to visualize ideally all of the margins and ideally all of those internal walls of your preparation. That's ideal. I mentioned if those internal walls somehow, if you have a little bit of undercuts, it is okay to leave behind, but you can build it up as well. You have to kind of use your best judgment. If there are undercuts on those vertical walls, do you build it up, or do you overextend or prep away a little bit more tooth structure to try to get rid of the undercut? But as long as you can see all of the margins of your preparation, you should still get a nice fitting restoration. All right, establishing a peripheral seal zone. So clean, healthy tooth structure, 2 to 3 millimeters from that margin. That's going to allow for a really good bond to the tooth structure, and we'll review that more in a minute. Establishing proper reduction. So on the occlusal areas, if you're doing an inlay, you want to make sure that you take away at least, think about 2 millimeters of reduction. That's going to allow for optimal material thickness. Even when you reduce by 2 millimeters, the final thickness of the restoration might be closer to 1.5, maybe less, depending on where you're at on the tooth. So you want to think about making enough room for optimal strength. Isthmus width, if you're doing an inlay, you want to have a distance, kind of a buccal-lingual gap, or it could be mesial-distal, depending on where the isthmus is. You want to have at least 1.5 to 2 millimeters of space in that zone for, once again, optimal thickness to that restoration. Cuspal coverage if undermined. So I'll review this in a little bit more detail in a couple slides, but I know that one of the big questions is, when do we cuspal coverage? At what point should we perform that cuspal transition? So I'll go through what that should be in a minute. Eliminating undercuts, kind of tying back into that path of insertion, path of draw. So ideally, eliminating those undercuts, prepping enough to eliminate those undercuts is optimal. A couple of approaches for undercuts. You can do the additive buildup, micro buildup internally, or the subtractive, taking away more tooth structure. You prep away more tooth structure to eliminate those undercuts. So you'll kind of have to use your best judgment on that situation. Rounded internal line angles, once again, making sure those transitions are rounded. And I'll have a couple of good examples that you can see. And the final thing is if you do prep subgingival, which many cases we certainly have to, depending on any pathology, any cracks, existing restorations, expose those margins as best as you can. All right, so we're going to start off with this case here. This is an inlay situation that I want to prepare for. This patient had caries interproximally, as you can see. This is 12, 13, 14, mesial distal of all of the teeth. And this is already just kind of beginning the dissection through the marginal ridges to expose the caries tooth structure. So they're not huge caries lesions, so we certainly could have taken a direct approach, and that's kind of one of the, we can debate this all day. Do we do a direct? Do we do an indirect? But I decided I wanted to do the most minimal inlay preparation that I thought applying these principles or guidelines for the preparation. So just to visualize what that would look like. So don't complain too much about an over preparation. I'm still trying to make a minimal preparation here. So this is after full caries removal, healthy DEJ, and again, we could certainly go through and do a direct, but I'm trying to make single indirect restorations for each of these. So I'm going to connect mesial and distal on all of the teeth. All right, so I take a burr. I use a burr that is about 1.5 millimeters in diameter at the tip, closer to 2 near the shank, but it transitions. So this is establishing the right isthmus width. So going across mesial to distal. And I prep across at a depth of 2 millimeters. I want to go down 2 millimeters, and I kind of measure that from the lowest point. So you can see where the lingual groove is on the molar, the buccal groove. Those are good areas to measure at because those are the lowest areas. Where the triangular ridges are on cusp, they're usually a little bit higher, so you still want 2 millimeters across those as well. And so it's a good idea to measure across all of those zones, but really making sure down where the grooves are, because the design is probably going to have a groove as well. So you want to really make sure you have 2 millimeters of depth through that area. Now, we're not done yet. So at these transitions, when I cut across, you can see these transitions from where those box areas are to that middle zone. These are sharp transitions. And if we left it like this and tried to make a restoration, we're going to end up with some problems. The mill is not going to be able to make a nice, smooth transition or sealed margin in that area. So what's the next step here? This is after rounding those zones. So I'm going to kind of go back and forth. You can look at where it's rounded. This is where we were. I'm just rounding all of those transitions. Another thing that I did here, this is the final preparation. Another thing that I did here to make it more millable is to, first of all, making sure from this bird's eye view, we can see all of the margins, eliminating those undercuts. These vertical areas interproximally, that's where I like to use that flame-shaped burr. Since we're prepping across both teeth, you can usually get a pretty good reduction in elimination of those unsupported enamel areas with the rounded, your normal prep burrs. But you can imagine if, against the canine, where it's a little harder to transition out with a larger burr, that's where I like to use a flame burr. Another thing that I did here, I'm just going to go back to the last slide. Notice the distance between the margins from one to the next tooth. I like to create separation of, which wasn't mentioned before, I like to have separation of at least 0.5 millimeter. Right now it's less than half. What I do is I take a probe, which is 0.5 millimeter in diameter at a tip. Pretty sure most probes are 0.5 millimeter. And I just run it across. If I can't passively move the probe completely through, then there's a decision to make. Do we prep more apically, which is a way, but in this case, used a small diameter diamond to create that opening. So you can see it's closer, and I created separation. The reason why we want separation is it's going to be easier for the scanners. So this is across all scanners. Half a millimeter, if we can make half a millimeter separation, there's less bridging or connection of the data on that digital model. And also it's going to be easier to design, it's going to be easier to seat, it's going to be easier to clean through that zone as well. So I made a little separation, and rather than, of course, if we move those margins more apically, that could also introduce greater issues. So this is the final preparation in what I determined, to the best of my ability, the optimal preparation using those guidelines: rounded transitions, rounded internal line angles, 2 millimeters of depth, 1.5 to 2 millimeters of isthmus width, trying to minimize or eliminate those undercuts. So you can use this as a reference for the most minimal, mill-friendly indirect inlay for the system. And we milled 3 camouflage for this case, and they fit really, really well. All right, so just a review of that case, just those real key areas: sharp cable surface finish line. You want the margins to flow. So sharp cable surface, but you want them to flow as you transition from horizontal to vertical, vertical to horizontal. Butt joint margins optimally, rounded internal line angles, so any transitions. So another area that I tried to smooth off are those transitions from the base of the box area, or the gingival wall, to the pulpal floor. And half a millimeter separation, 2 millimeters, 1.5 to 2 millimeters of isthmus width and depth. All right. All right, crack and caries removal endpoints. So this image I have to credit, this is from, I think it's on the next page. This is Dr. Taylor Patton, and he has this website, the hybrid layer. A lot of these concepts were adopted from Dr. David Alleman, Dr. Davey Alleman, big biomimetic guys, incredible researchers, and so, but great illustrations from this site. Thehybridlayer.com has really great images, and really they talk about the fundamentals of biomimetic dentistry, trying to restore the tooth in the most natural way. So I don't have all of my methods perfectly following the biomimetic protocol, so, but I do adopt a lot of the preparation principles, which I think is really obviously the foundation and the most important. And of course, the bonding protocols are important, but we'll review that a little bit later. But this isn't a biomimetic discussion. So partially biomimetic, but not a true biomimetic protocol. But this is something that I think is obviously very important, determining how far down within the preparation you should go. And so using this principle of caries removal endpoints of 3 millimeters into the tooth, so you can see measuring from where the contact area is into the tooth, 3 millimeters, and at a depth of 5 millimeters, that's as far as it is advised to go. All right, so any carious tooth structure that falls, if it's 6 millimeters or anywhere beyond 5 millimeters, it is recommended to leave it behind. So excavate as much of the carious tooth structure or crack within the tooth, 5 millimeters of depth, 3 millimeters into the tooth from the interproximal. Of course, 3 millimeters means at the depth of 5 millimeters, 3 millimeters in. So we can go certainly more into the tooth if you're higher, above, or less than 5 millimeters of depth into the tooth. So just some definitions: horizontally, those 3 millimeters interproximally, vertically 5 millimeters occlusally from that caval margin. So this is a case example. This patient came in, number 14, cavitation, large cavitation. We're going to go through, and I'm going to kind of speed through this video for the sake of time. Most of our cases, we're going to scan a preoperative case. We like to go ahead and establish the pre-op just to have the contours of the original, but also a great thing is we scan the bite in that pre-op as well before the patient's been open for who knows how long for the preparation, where things can kind of get out of whack. So I find we get the most accurate bite at the very beginning of the appointment and also before they're numb. So using that large round and tapered diamond, we know we have a cavitation, we know we have caries tooth structure. I'm basically going down apically, again, down apically, remembering about 5 millimeters, no more than 5 millimeters, and from that 5 millimeter depth, no more than 3 millimeters into the tooth. But I'm basically trying to circumscribe. I want to see what my external outline is. How large is the prep going to be so that we can remove as much of the caries tooth structure as we can. So I'm going kind of shallow here. I'm bringing the prep toward, we're on the mesial side, we're bringing the prep distally as much as I can. And again, using the DEJ as a guide. So staying shallow, following the DEJ, I'm just prepping until I can see healthy DEJ. And so we're going to speed through here. So prepping toward the buccal, prepping toward the lingual. You can see still some soft tooth structure in the center. All right, so once I've kind of established healthy DEJ, utilizing, this is a Caries indicator dye. So this is going to stain any demineralized, denatured dentin tooth structure. So you can see how that's, what I'm really focused on is there any at the DEJ? If there is, then I need to expand or extend the preparation even more. I want to see it concentrated just in the dentin. So I'm not, in this case, I'm not actually fully abiding by that caries removal endpoint. We're already at a depth of 5 millimeters, but I'm, probably OCD like many other dentists are. I would like to try to remove as much of the caries tooth structure as I can. Obviously, very, very dangerous to do. You have to do so very carefully. And in this case, you can see I'm right at the pulp horn on the buccal, that mesial buccal area. And I'm not even sure why I decided to just touch it. Actually, I know why. I was trying to see if I could get that little green speck that's kind of staying on the nerve off of there. But I'm just trying to, just as gently as I can, slow speed round burr, trying to remove as much of the caries tooth structure. Now, this is my direct pulp cap protocol. It's worked well for me. I know there's a lot of different approaches, and some are probably freaking out at the fact that I'm putting phosphoric acid on there, but I put phosphoric acid very quickly. Then I follow that with, that's a desensitizer, Gluma. And then now I'm using a Vitribond from 3M. This is a glass ionomer liner that I'm going to put down at the base of the tooth here, covering the pulp cap and just providing a little insulation to the tooth, to the nerve, and just kind of extending it here to the lingual over the pulp zone. And we're going to cure that and set that into position. Again, this is that's a protocol that's worked really well for me over the years. Now, from that point, we've removed as much, excavated as much of the caries tooth structure as we can. Here on the lingual and buccal, I'm just trying to eliminate and make those smooth flowing margins, eliminating any undercuts. Here on the mesial, a little bit subgingival, I'm packing a size 2 cord in. And we remove the cord for the scan. Inlays and onlays. So now for the scanning protocol, you really want to make sure that you're going to have to take a little bit more different angles than you would traditionally for a crown prep, because now with these vertical areas along the margin, you're going to have to include those as well. So just a straight buccal, straight lingual oftentimes are not enough. You sometimes have to lift off the end of the handpiece or the scanner wand to capture it. So this is a camouflage restoration, and on the try-in you can see a great fit. Through this a little bit more, checking the margins. And I go ahead and pack, this is a size 0 cord, just to kind of help move the tissue away a little bit. We're using an IsoDry for isolation, and I know I'm probably going to get some hate out there for no rubber dam, but I'm a little weird this way. I like to try to see how long these restorations can last using the most minimal approach. So, and in my hands, I've been, knock on wood, very fortunate. Things have been working out pretty well. So going back to the bonding, so we do a total etch, 20, 30 seconds, rinse and lightly dry. Then we follow that with a desensitizer. This is Gluma. We let that soak into the tooth at 1 to 2 minutes, Any excess will aspirate the excess. And now I'm scrubbing in our bonding agent. Here I'm using 3M Scotch Bond Universal. Go along the margins, really scrub it into the tooth, any exposed dentin to create that nice hybrid layer and integration of the formation of the tissue tags, or resin tags rather. And now we're going to seat this down. At the time of this delivery, on the restoration itself, we air abrade the camouflage, and we also apply our bonding agent to the internal of the air abraded camouflage. We air abrade the camouflage to create a roughened surface. That's also how we would etch or roughen a bruxer restoration for bonding, ideally done after try-in, which cleans the bruxer and also mainly cleans it, but also, of course, the roughening of the intaglio. All right, so the cement that we use at this time, this was Reliax Ultimate 3M's adhesive resin cement. We tack cure, remove as much of the excess as we can, and once most of the excess is out, then we final cure. All right, and of course, now for the occlusion, we check the bite. A lot of times, and I hope I'm going to go a little faster so we can actually see the design. Here I'm going through and adjusting the bite after it's delivered using a fine grit diamond, and also any areas along the margin. This is one of the great things about having access to the margins on the buccal and lingual. Just a light transition. I'm going at a low speed, 5,000–10,000 RPM, really gently going along the margins, smoothing those out. The smoother those transitions are, the system makes a great fitting restoration, but again, it's not perfect, meaning, you know, they might have little micro steps somewhere through the margins. So I use a fine diamond just to smooth those transitions, and then follow that with, that was a coarse grit composite polisher, and whatever composite polishing protocol you like to use. And I'm just checking to make sure that we have smooth transitions throughout. The smoother those transitions are, the less likely plaque accumulation and buildup along those areas. All right, so Caries indicator dye, the use of this, if you're not using it, I think this is really helpful, and it provides an objective feedback on and visual on what tooth structure is soft and demineralized. So this is from Curare, their Caries indicator dye. You apply it and let it sit for at least 10 minutes, and then you're going to rinse and remove the excess, and anything that is infected will be stained. This is the last prep that we did. This is with the pulp cap and the cord placement, and at try-in and the delivery. All right, cuspal coverage, whether or not the cuspal coverage. So this is a cross section of premolar on the left, molar on the right. Normal occlusion, patient in normal, not in crossbite. So one of these cusps is under compression, and the other side is under tension. So you can see so starting off on it's actually the same. So maxillary premolar, maxillary molar. So the lingual of maxillary teeth, in normal occlusion, those cusps are under compression. The buccal of mandibular teeth are under compression. So it's basically the cusp kind of fitting that's inside of the middle of the opposing, or the central fossa of the opposing. Those cusps are under compression. And when the tooth structure is under compression, it is stronger. The non-functional cusp, as you can see, the buccal of maxillary teeth, the lingual of lower teeth, those cusps are under tension, so more lateral forces. So the cusps, and those are often the cusps that you see, if they are to fail, if you see failures, a majority of the time it's those non-functional cusps. So it's the tooth or cusp under tension. So given that, we have a couple rules, and this is the recommendation from the biomimetic crew. So cuspal coverage, functional, the cusp under compression, the stronger cusps, if you're under 2 millimeters of thickness, and this is measuring at the base of the cusp. If you're less than 2 millimeters in thickness, it's recommended to cuspal coverage. On those non-functional cusps, if it's less than 3 millimeters, so that those cusps are under more tension, under more pressure. If it's under 3 millimeters, then that's when it's recommended to cuspal coverage. I hope that makes sense. Okay, just another kind of, you may have heard the bull rule from denture. Hopefully it's not bringing any PTSD on you. But the bull, buccal of uppers, lingual of lowers, those are the weaker or non-working or non-functional cusps. They're at greater risk of fracture under tension. All right, bulls are weak. Okay, the next really important aspect, measuring down. This is showing an onlay preparation. I'm measuring here. I often will measure at this is the lingual groove, and also at the marginal ridge area. Since those are the lower areas on the occlusal, I want to make sure that we especially in those areas, have 2 millimeters of depth. And that is meant for optimal thickness. And isthmus width, using a burr, long burr, short burr, doesn't matter, whatever the diameter of the burr, knowing the diameter of your burrs to pre-measure, to know that, just to kind of save time, to know that you're establishing the right isthmus distance. Thinking about undercuts, making sure you eliminate those undercuts, especially along the margin. This is the path of insertion view. And I think I'm almost done with showing cases. This is a case, patient had direct composite, a lot of recurrent caries, and I decided to leave that mesial buccal cusp intact. It was really the only cusp that was healthy and didn't have any carious tissue. Now, this remaining cusp, because it's greater than 1.4 millimeters at from margin to margin, another area we're going to have margin to margin closeness will be on teeth with furcal involvement, where the furcation, it's going to be a real close margin to margin distance. Those areas are going to have, you're going to have more trouble with the system. Meaning the system might actually avoid cutting through and opening that up because of the greater diameter of the burr. So as long as we have 1.4 millimeters, at least 1.4 or really greater than that, the burr is going to be able to pass through and create that opening. So we were able to create that with the system. You can see how nicely the mill cut that. And it is always amazing to see when you can create a really nice partial coverage restoration and follow those principles, follow those guidelines, and the system makes it for you, and the restoration seats so nicely. It's always a great feeling, and you can see how nicely that restoration adapted to that remaining cusp. All right, so I'm going to try and get through the design of this case. This patient had a fractured MO composite with also recurrent decay, and we're going to open this up. This is just showing you the before and after radiographically of the change we made for the patient. This is beginning of the preparation. This is showing after most of the preparation is done. I also reached the pulp horn here. You can see we're at a depth of 5 millimeters, so this is 5 millimeters down. This probe is 2 millimeters per line, and just kind of illustrating that point of those caries and crack removal endpoints. 5 millimeters is really the maximum that you should go. This is the final preparation, and I won't go through the video here. I'd like to at least get through this design. So the design of this case, we're going to start off with margin marking. So with partial coverage, the system is not going to pre-mark the margin. So this is autocomplete, meaning the system's trying to find the edge of the margin. And when autocomplete is on, I usually just try to find an area where it does okay. So I'm going to start off interproximally. I give it a click, and notice how so far so good. It goes up the margins okay, and right here it goes over the cusp tip instead of coming inward. So I'm going to, if this ever happens, you can just left click on the good area. We're going to back it up. I'm going to try and guide it on the margin. So this looks okay. Here it's kind of jumping off toward the buccal. I'm going to back it up and we'll cut across. That looks okay. I didn't see the rest of it. Hopefully you got most of it. There we go. So not bad. I'm going to go ahead and improve and just kind of refine this a little bit, just left clicking and holding and dragging this over. I like to err a little bit to the outside on these horizontal areas, these flat areas on the prep for good seal, good coverage. You can see I did pack a cord here for good separation. These vertical areas on the margin, this is where you have to be careful not to take the margin too far out. If you take it too far out, you could potentially get some hang-ups or interference, so be careful with that. So I'm just going to keep this right on the edge as we go up. Let's extend it there. Of course, there's curvature too. We can turn that on just to kind of illustrate what that looks like. This I'm going to allow it to transition over, cut across. Here on the distal, looks good, just kind of right on the edge there. And mesiolingual, and now down the vertical area, just kind of getting it right on the edge. And that's about it for the margin. Turn off curvature. So that's the margin for this prep. The next thing before we move on to design, occlusal and buccal arrows. Buccal, just somewhere toward the buccal. The occlusal, you want this to be perpendicular to the occlusal plane. So since we have unprepped areas of the tooth, just kind of imagine the occlusal of the tooth is kind of a table. If there were no cusps remaining, you can use the adjacent teeth as a reference. So imagine being perpendicular to the occlusal plane of these teeth, and then you can give a double left click on the occlusal arrow to kind of snap it to how you're viewing the teeth. From that point, and don't spend too much time worrying about that, just somewhere as long as it's close to the occlusal. All right, so next we're going to go to design, and the initial proposal for partial coverage cases will be the library proposal. So the library is a generic design for whatever tooth you're working on. So in this case, number 15, it's just going to take a generic, every number 15 case you go through, you're going to have a generic library, or any tooth you're working on. It's just one embedded library, which we're looking to expand at some point. So for right now, it's one. You'll often see maybe an undercut warning. You may see this. You might actually even see a wrong occlusal direction warning as you transition from margin to design. You can see where that undercut warning is. It's important to consider. So I'll quickly show you if you go to the insertion direction just to see where that is. If you don't really see that the margin in red, you should be okay. It's pretty sensitive. Sometimes just a little tweak of the margin inward. You just really want to make sure you're not too far out beyond where you cut on the tooth. So I'm not going to worry about changing the margin right now on this case. All right, so this is the starting point of the design. So you can see it takes a library tooth. When the library tooth drops into place, it doesn't establish the occlusion. It doesn't even close the contact. As you can see, it's slightly open. But that's not a problem. What I'm looking for here is, does the design look like a nice puzzle piece that fits in the prep? If it is, then it's very easy from that point to establish the other areas. So I'll first show you with the automated function. So here in the contacts window, using the automated function, how can we establish the contact and occlusion? But before I do that, just going back to the general position, just get an overall look. Does the overall design kind of fit this space well? If you had a buccal and lingual area to the design, do those contours flow well with the adjacent teeth? Sometimes, and you can see this buccal shelf here, this soft tissue, sometimes you can cut that away too if that is impeding your view. But I think it's okay right now. So what I'd like to do is I like to try to get the marginal ridges of my designs, of my restorations close to one another. So I'm going to go first to freeform, and I'm going to maximize the size of freeform here. I'm using the right click hold followed by the left click and hold, and I'm moving the mouse forward. If you weren't familiar with that, you can see that slider bar moving to the right. You can also use that. And I'm just kind of dropping this marginal ridge area down, kind of looking from this mesial side. I just want it to be a little bit lower. We're not in any occlusal interference here, but just to make it more seamless, it allows for more efficient chewing, and it'll be easier to clean through that zone too with the marginal ridges a little bit closer in height. So I'm going to start with that little adjustment, and from that point I like to exhaust any big changes first, and then now let's go back to the contact window, second on the left, second from the top, and back in the contacts window. So before you hit fixed contacts to set the adjustment or make the adjustment, I would recommend first checking the contact spot. So in this case, we only have a mesial contact. I'm going to go to Edit Mesial Spot. And it's always important to do this first because sometimes the software does not draw the contact in the right area. So I'm just actually going to left click and hold and just kind of move it off to the side for a second. Now when you draw, you can absolutely draw it in the wrong area. If you drew here, you're telling the software we want a contact on the lingual. That's not ideal. So what I like to do is, since it takes you to the straight on view, I like to rotate down slightly. Just visualize what part of that, in this case number 14, that mesial neighbor, what part of that tooth is facing number 15. And that's where we want the contact to adapt to. So understanding where that is, you should hopefully, it should prevent you from drawing the contact too wide. So we're going to concentrate it on that contact area, the distal wall of 14. Another thing that I like to do is using the reflection in the software. So we can see this nice reflection. This is about that contact area, and we can go ahead and concentrate it here. So where you imagine you want your contact to be, draw slightly smaller, because the software tends to overbuild the contact even bigger than what you just drew. So if you think you want a contact all the way to here, make it smaller. So I'm going to keep it a little lower, a little away from the edges of the reflection to the limits of the reflection. You also don't want to draw it too low into the undercut of the neighboring tooth, which could introduce some problems in your when you try to go to seat that restoration down. All right, so I drew the contact there. You can double check it from the top. And we're going to go ahead and save it. And now when we hit Fix Contacts, it will adapt to what we just drew. We're going to double check the contacts. This is a camouflage, or you can actually see it's set up for Obsidian. I normally have the contacts set to 30. Now the software will automatically go to 80 for the most terminal tooth, for camouflage, biotemps, and Obsidian. I like 30. If you haven't done any terminal teeth or partial coverage cases yet on a terminal tooth, I would say stick to 80, and if you have a lot of adjustments to do, then dial it down and find your sweet spot. So I'm going to switch it to 30. For our occlusion, I do like -200, and you'll see once I hit Fix Contacts, the software is going to adjust the proximal contact, it's going to adjust the occlusion. But you're probably going to see this warning on top. Notice how it says unreachable contact value for number 15. That's because due to the fixed position of the margin, and since the software is always preserving optimal material thickness, especially along the margin, really it's throughout the whole design, we're not able to get to that -200. And that's where once we try the restoration in, and you can of course adjust the heavy contact during the try-in, but I like to wait until I bond it in. So obviously if you adjust it at just the try-in or check the occlusion until the tooth is bonded in, these areas are very weak. So I recommend waiting. Now you can follow the adjustment. I know it looks a little bit thick here. You can smooth it out, but of course you're going to at some point reach that minimal thickness violation or warning. So you can smooth a little bit, but you can finish the rest of that after it's bonded in. Now you can see how we adapted the contact and it looks good. Now that's pretty much it for the design. One area that I do recommend checking. So there's two things left before you send this to the mill, and you should always check it. First one is the path of insertion. So on the left-hand side, third icon from the top, we're going to re-enter the margin tool. This is where the path of insertion is. The left side is margin, the right side is path of insertion, which we saw earlier when we first came here. This is something that will eventually be changed and corrected, but right now, notice how this current path of insertion, if we look straight, this is what the software set as the path of insertion. It is isolating the prep and trying to set the insertion by minimizing the undercuts on the walls of the prep. This applies to crowns, this applies to veneers, this applies to, as you can see, inlays and onlays. Notice how it's angling it to the mesial because it's trying to eliminate the undercuts. Because if we had 15 alone, this is a great setting. But the problem with this is, since it's so far to the mesial, notice what it does. You can see when you check the insertion, there's also an undercut over the adjacent teeth. And right now, if we had this insertion direction, our entire contact area is inside of the undercut of the neighboring tooth. So since it will mill the internal of the inlay with this path of insertion in mind, we're going to have some trouble trying to seat this because of the contacts being in the undercut. So how do we fix that? So what I recommend doing, let's hide the design. I recommend trying to get more of a vertical preparation, basically following the long axis of the tooth. And you can do this as long as your preparation has the walls divergent enough. So instead of this, I'm rotating to a more occlusal view, and it actually exposes more of the distal of 14. And now I'll double click the green. Double clicking the green, it straightens out the path of insertion. Yes, you might see some undercuts forming internally. I would not worry about that. Yes, a little bit on the margin. Let's see if we can go lingual just to see if we can hide a little bit of that margin. Not really, that's probably where that warning was. Yes, we could move the margin inward a little bit, but the key thing here is, notice what it does to that contact area. It opens it up. Now the contact of our design is not really within the undercut. I know you see a little bit of red there, but that's the bit of red that you have right over there. It's kind of a little indentation on that neighboring tooth. So on the topic of the neighboring teeth, to get great contacts, to have an easier time seating restorations, number one, on the preparation, which we didn't talk about for preparation, but this is super important. Think about establishing a smooth contact, a smooth wall, flatter wall, more convex in shape ideally, of a neighboring contact. That's going to allow for a good surface to adapt your design to. If that neighboring tooth has undercuts, if it's a little bit rough, if it's really irregular, those are harder surfaces to adapt the design to. You're going to have more trouble in design, and certainly probably a greater chance of issues during the seating. So think about the surfaces of those neighboring teeth. And this is super important, thinking about making that insertion direction more vertical. I check this even for crowns to try to straighten out, because if you can imagine for a crown, if your prep is angled slightly to the mesial, kind of like this situation, you'll end up with this more mesial insertion direction. So if you can straighten things out, eliminating the undercuts of those neighboring teeth, you will run into less issues during the seating. And this changes, it doesn't change so much the way it cuts the outside, it changes the way the inlay gets cut from the inside. And so when we can cut the inside of the inlay or any restoration with a more vertical insertion, factoring in those contact areas, you're going to have a better adaptation. So I mentioned there's two things. I'm going to go ahead and X out of this to save this new insertion direction. The last thing to check will be I know it says wrong occlusal direction. We're going to bypass those couple of warnings. And the last thing I would recommend checking is the sprue position. So to check the sprue, we're going to go to view nesting. Instead of send to mill, hit view nesting. We're almost done. We're going to hit yes to accept it. It was kind of giving a warning for thickness. We'll confirm the material, confirm the block, just a good double check that you selected the right material for the case. And what this does is generates a milled simulation. And on the left-hand side, third from the bottom, this is sprue position. Only until you've run view nesting can you visualize this. So there it actually set the sprue away. Sometimes I see it on the contact. So anywhere you see highlighted in blue, you can click on it, or you can click and drag and position the contact, or excuse me, position the sprue. So ideally, obviously we don't want it really on the contact. If the external outline, you can imagine if you have a smaller inlay where the box isn't extended to the lingual like it is here, you're going to have the sprue just can't go anywhere else besides the contact. So the mill does thin the sprue pretty small now. So hopefully it eases the finishing and the try-in and the seating. But with the advantage of having a larger preparation is we can click away from the contact and get it safely away, so that if we're not finishing the sprue off the contact. It just makes the finishing and seating a little bit better. And then now we can send it off to the mill. All right, I apologize, I went a few minutes over. I'm going to check back in to see if there are any questions.